Hey everybody, welcome back for another episode of Physio Show. Today, I'm diving into the world of physical therapy clinics, shedding light on what separates the good from the bad, and most importantly, how to recognize if it's time to seek treatment elsewhere. This video is also for therapists who are looking to avoid working in a negative work environment. Because not all physical therapy clinics are created equal, and unfortunately, subpar care can undermine both patient and therapist well-being. So let's uncover what you need to know when it comes to physical therapy clinics so you can avoid the bad ones. And at the end, I'll be sharing what physical therapy clinic and type of therapist I would personally seek out if I needed physical therapy. Burnout is a real issue in the physical therapy industry, and it continues to worsen by the day. Big PT chains are buying up all the smaller clinics, and unfortunately, some are being run by those more focused on productivity versus patient care. Big surprise, right? Well, this results in unrealistic productivity standards that are running PTs into the ground. So this is less of an issue with the actual physical therapist, as it is with the structure of their schedule. You can tell you're in a PT mill when the therapist is constantly balancing sometimes 3 or 4 patients at once, which provides them little one-on-one time needed to properly assess and make the necessary modifications to patient treatments each visit. Typically, the patient will be told to hop on the table right away, or are immediately asked to perform exercises without much discussion as to how you're feeling, how the home exercises are going, or an established plan for the day. And again, this isn't the therapist's fault. They just don't have the bandwidth to dedicate enough thought to your treatment plan. This results in the physical therapist feeling overworked, unhappy, and ultimately providing poor quality care. A telltale sign of burnout in a clinic is if the clinic has all young therapists fresh out of school. Burnout will result in high turnover rates of therapists, and the clinic will struggle to retain more experienced therapists on their staff. This negatively influences the culture of the clinic, which inevitably influences patient care. When picking a physical therapy clinic, look for ones who schedule a treatment session so there is no overlapping treatment times with other patients, or who at least have supportive staff. Some clinics have rehab aides who assist therapists during sessions. With their help, a therapist can effectively see 2 patients in an hour, sometimes 3 if it's planned carefully, but that's pushing it if it's done too often. But it's best when it's just 2 patients. These aides are really important because they help therapists give each patient the attention they need. Because even though therapists are superheroes who do awesome services, even they can't be in 2 places at once, not to mention 3 or 4. But if the therapist is constantly seeing more than 2 patients in an hour, there is no way they are able to give each person enough time and attention. Oh, the revolving door clinic model, the I will see you for this many months indefinitely approach. Patients deserve a clear path to recovery with treatment guided by established goals and an expected end date, with an ultimate focus on making the individual patient super confident in self-managing their condition. It's not about signing them up for endless cycles of appointments. You see this more commonly in clinics who have a cash-based model, where patients pay out of pocket and don't go through insurance. But it can happen anywhere, even in insurance-based clinics. This model promotes poor practice habits, as treatment decisions can be influenced by financial or productivity incentives. When clinics operate with the sole focus on keeping patients on their caseloads as long as they can, they are putting profit over the patient's needs. The investment should be to the benefit of the patient's health and well-being, not to line the pockets of the clinic. And if you're told you should keep coming in for maintenance therapy, it's a sign that you might want to find another clinic. You're not a car in need of a constant tune-up. After receiving structured therapy, the goal should be for you to be on the right track to managing your own health. It's the therapist's responsibility to guide you to a point where you can take control. So steer clear of clinics that foster a sense of dependency, making you rely on them for improvement. It's truly amazing to me how outdated care continues to be provided in some clinics. Despite lacking support from evidence, certain outdated treatment strategies are still being utilized. If you find yourself in a clinic where the therapist relies heavily on modalities such as heat, electrical stimulation, ultrasound, and barely engages you in active exercises, it's time to reconsider this clinic. This rinse and repeat approach belongs to a bygone era. However, it still happens and is due to the therapist failing to evolve with the times. These clinics tend to offer the same treatment plans to every patient, regardless of their individual needs or conditions. They often rely on generic exercise routines and passive treatments, where the patient hardly gets off the table. Exercises are likely just regurgitations of what the patient has already been doing for weeks at home and just feels boring and uninspired. And you would think this is more of an individual therapist issue and not the clinic, but it's actually a sign of a systemic clinic issue going on that would allow such non-evidence-based treatments to occur. Remember, your care should be driven by the latest evidence and best practices, not outdated traditions. So what would I look for if I needed physical therapy? Well, I would look for a physical therapy clinic that had specialist level clinicians. Therapists who have extra credentials, such as an orthopedic specialist or sports specialist. These credentials signify they went through additional training to specialize in a particular field of physical therapy. I would also make sure that they did not see more than 2 patients within an hour so that they could focus on my needs. I would also prefer they had supportive staff on hand to help them manage their patient caseload. That way, I know they have enough time to assess my response and modify treatment as needed. I would also make sure they had sufficient equipment in their clinic. TheraBands are only going to get you so far. If you're looking to rehab fully, you're going to need weights and machines. I would look for a clinic that is attached to a gym or has this sufficient equipment on hand. Lastly, I would want to make sure they are following current evidence-based practices. An easy way to tell this, if you didn't know what that was, would be to ask them about why they chose their treatment strategy. If you get a blank stare or lackluster answers, the therapist is probably not following current evidence. This question should be answered with confidence, with the therapist able to justify each treatment decision from the education, manual therapy, and exercises in depth. Are you a therapist or patient who has experienced these types of clinics? Feel free to share your experiences in the comments. I'd be interested to hear your thoughts. And if you like this video, give it a like so it can spread and help more people, so they can know which types of clinics to avoid. And consider subscribing to the channel so you can continue to learn more about your body, how it works, and what it needs to keep moving.